Tell me a little bit about competition. We didn't talk much about this earlier, but we see more companies and types of organizations around the country looking at getting into health insurance. How worried are health plans in New York?
I think the way our members would look at it is competition is a good thing. The focus needs to be on how do you get at underlying healthcare costs. I think one of the big challenges that's faced the marketplace both here in Western New York and the rest of the state is the ongoing consolidation of provider organizations, whether it's hospitals coming together or physician practices merging or hospitals acquiring physician practices. Ultimately, what that does is drive up market leverage and increase prices. The rationale typically for these types of mergers and acquisitions or affiliations is that it will lead to better integration, it'll lead to better care, it'll lead to lower cost or greater efficiencies. The national data says otherwise, that typically when providers come together, it leads to higher costs and it doesn't improve the quality of care. I think that's something that policymakers and the employer community really need to take a strong look at going forward to ensure that they're getting value for the healthcare dollar. At the same time, the plan's been very focused on measures to improve quality, to take different approaches around alternative payments and be paying for value as opposed to volume. And the health plans have really been leaders in that space. So, as we look to other companies that may want to get in on the healthcare game, I mean, competition is a good thing. It might encourage different approaches and new ways of getting at healthcare costs, but ultimately, the focus needs to be on how do we make healthcare more affordable for employers and consumers, both here in Western New York and the rest of the state.